Hey everyone, I'm Dr. Adam Eyre with Frontier Pediatrics in Twin Falls, Idaho. And today I'm here to talk with you about well child checks from birth until around a year old. Now, you as a brand new parent want your child to develop the very best that they can, and we do too. We plan to see your child within 2 to 3 days of going home from the hospital, again at 2 weeks old, and then at 2 months, 4 months, 6 months, 9 months, and 12 months old. Let's talk about what to expect at each of those visits. So your child is 2 to 3 days old. You are super tired as a mom. You're super tired as a dad. Why the heck are we making you come into the doctor's office to get your baby checked out? Well, there's a couple of really important things. We want to make sure, first of all, that your child's not losing too much weight. It's expected that a child's going to lose weight initially after they're born. They're waiting for breast milk to come in. They're waiting for learning how to drink enough from the bottle. And yet they're peeing and pooping as well too. So they're going to be losing some weight, but we want to make sure they're not losing too much weight. In addition to that, we want to make sure your child's not getting too jaundiced. There are certain conditions that predispose your child to jaundice. That's the yellowing of the skin, and that can be pretty serious. So at 2 to 3 days old, it's really important to follow up with us to make sure your child's growing well, gaining weight. What do we expect from your child at 2 to 3 days old? Not much other than feeding, sleeping, peeing, and pooping. So you're going to be doing a lot of diaper changing, lots of feedings, and letting them learn to take that in and grow. Your child will not be receiving vaccines at this appointment. That won't be until 2 months old. So now your child is 2 weeks old. This is exciting. You're getting your feet under you as a parent. Hopefully you're starting to sleep a little bit more at night. This is the age that your child should be back to their birth weight. And if they are, it's time for celebration, because your pediatrician will tell you, great, now anytime your child wants to sleep longer at night, you can say a thank you prayer and enjoy the extra sleep that you get as well too. And you as a parent are going to have a ton more questions about how I parent this little infant, and we're there to help you. This is the earliest that a child may start to smile at you. This is the icing on the cake as a first-time parent. You'll see your child first smile with a little sparkle in their eye. And then they'll kind of figure out, hey, I ought to be doing something with their mouth. You may see them kind of doing this sort of thing, and then all of a sudden that first smile breaks out. And that makes all those sleepless nights and waking up in the middle of the night feeding your baby worth it. Soak it in, love it up. From a development standpoint, your baby is starting to have a little bit more head and neck control. Hopefully you're giving the baby lots of tummy time, and you're seeing them becoming more socially interactive with you. Not making cooing sounds yet, but that smile that we talked about, and really starting to track you a lot and follow you around with their eyes. Your child is now 2 months old. They are holding their head and neck up really well. When you're holding them up under their armpits, they can keep that head and neck up without being so floppy. When you put them on their tummy, they have to be able to lift up their head about 45 degrees. They're still keeping their hands pretty close-fisted, but they are smiling a lot. They are making cooing sounds at you now, a lot of the oohs and ahs, those vowel sounds, and it's just making you so happy as a parent. Most babies at this age are starting to sleep a little bit longer at nighttime. Hopefully they're giving you at least a 4-hour stretch. At this age, however, when your baby wakes up and cries, they still need you. They need to either be held, they need to be fed, they need to be changed, they need to be warmed. You can't spoil a baby at this age. So don't worry about sleep training your baby at this time. If they're giving you longer stretches, keep it quiet. Don't tell all your other mama friends, because they'll be jealous. But most babies are giving you 3 to 4 hours of sleep at nighttime. At the 2-month visit, we'll be showing you how your child is tracking on their growth curve, both their height, their weight, and their head circumference. We will be giving your child their first full set of immunizations. If you have any questions about those immunizations, that's what we're there to talk with you about at that visit. If you have any questions beforehand, you can give us a call, but we'll spend a good amount of time talking at the visit. Congratulations, your child is now 4 months old. This is my most favorite time in a young childhood's life. They are so social, they're not strange or anxious yet. They'll smile at everybody, including me at the doctor's office, so I love it. They have developed more truncal control. You should be able to have your baby sit up in your lap and hold them just around their waist, and they'll keep their trunk upright. They've already been keeping their head upright for quite a while. When you put them on their tummy, they're learning how to push down with their hands and get their body up and their head up in a 90-degree angle. Likely also starting to learn to push with one arm and lean to the side and learn how to roll over from their front to their back. They're also learning a lot more about their hands, their fine motor control. You might notice that as they're laying on their back, they're just kind of flailing their arms around, and then they suddenly look at their hand and figure out, oh my goodness, that's my hand, oh that's my thumb, that's my index finger. It's so fun to see all the cogs and wheels in their brain learning about those things. You'll see them starting to learn to reach forward with their hands and grab things right out in their periphery, and they'll bring objects to their midline and want to hold them with both hands. They still don't quite know how to let go, and so they'll grasp on and they'll seem to kind of struggle. Or if they grab it onto your hair, they're still not quite sure how to let go of that yet. But they are developing their fine motor control. They're starting to coo a lot more. They're still smiling. They may be starting to learn how to giggle and laugh, which is another big warm of your heart for a parent. This is the age that we may talk with you if your child's ready to start doing some sleep training. We want your baby to be able to sleep longer and for you to be able to enjoy your rest as well. If you want any more details on sleep and sleep training your child at this age, please refer to our other videos. 4 months old is also the earliest that we'll talk with you about if your baby's ready to start doing some baby foods. At the end of this visit, your child will receive another set of immunizations. All right, mom and dad, your little one is now 6 months old. This is exciting. Your child is starting to develop more cognitive awareness. They're starting to recognize familiar and unfamiliar faces. Unfortunately, for me as the pediatrician, that may mean that your child isn't too happy to see me at the office that day. But they are loving to see you, and their face is lighting up anytime that they see you. Other things to anticipate with your child's development at this age. They should be able to sit up by themselves with very little support to no support and keep their balance on their own. They may start to lean to one side and learn how to put their arm down and kind of right themselves. From a fine motor standpoint, they're also learning how to reach outside of into their periphery and to be able to grab objects and bring it to the midline to be able to play with. They know how to transfer objects back and forth between their hands. And from a language standpoint, this is where your child begins to start making consonant sounds, like those hard D sounds and G sounds like da and ga and ma. Now we recognize, and you should too, that all children develop at a little bit of a different pace. Some children are a little more advanced in one category than the other. If your child's not meeting all these milestones, don't worry, let's talk about it. We'll come into the office and we'll assess how your baby's doing. We'll give you tips on how to get them there. At 6 months of age, your child is a mover. They're learning how to roll around to get to stuff. This is your last chance as a parent to really safety-proof the house, to make sure that your child can't get into things that are choking hazards or electrical cords that they can pull on and pull something heavy onto themselves. So make sure you're making your child have a safe place. From a sleeping standpoint, at this age, your child should be giving you a consistent 6 to 8 hour stretch of sleeping at night. If they're not, let's talk about that and get your child there. Again, you can please look at our other videos on sleep training. At 6 months old, your child is likely doing really well with eating solid foods. We want you to be experiencing with different textures and other different flavors. Please refer to Dr. Turner's video on feeding your baby at this age. At the 6 month visit, some of the key things we'll be talking about is feeding your baby appropriately, how's your baby sleeping, how's your baby developing, and how to help them thrive. At this appointment, your child will also receive another set of immunizations. A fun developmental milestone at 6 months old is the awareness of object permanence, where objects and people still exist even though they can't see them. This is the age where peekaboo starts to become fun, where you can put a blanket over your head and your child knows, hey, mom and dad's still there, right? And then when you lift up the blanket, then, oh, that's so fun, because they were right, you were still there. That can come with some pros and cons. If your baby is not yet sleeping in their own room, that may make it a little bit difficult to move them to their own room. So as early as you can, at either 4 months or 6 months, try to start moving your baby to their own room so they can get used to that space on their own. All right, mom and dad, your baby is now 9 months old. This is such a fun age as well too. They are moving a lot. They are likely figuring out how to pull themselves up to stand, and then starting to take some side steps while they're holding on. We call that cruising. While this is fun for them to learn to pull themselves up and stand and cruise around, expect that they're gonna fall and get some bumps and bruises. That is okay. If you have any concerns, we're here for you. At 9 months old, your baby's language is developing into what we think is true baby talk, right? They're repeating their consonant sounds. A lot of goo goo, gaga, mama, dada. May or may not be specific at this age, so watch for that. But usually that first specific word is not till around 12 months old. With regards to eating, they're doing table foods now, right? They don't want that gloopy baby food anymore. They want what you're eating, right? You may get them to eat better by actually putting food on your plate and letting them see you scrape it off onto their plate or their tray. They're wanting to use their hands to eat. They want to be in charge of it themselves. Make sure you're cutting things up to appropriate sizes and make sure it's soft enough, because they don't really have teeth yet, that they're going to be able to mash that up in their mouth with their gums and their tongue, and it won't be a choking hazard. And by now we want your baby to be learning to drink from a cup, a sippy cup, a strawed cup, or an open cup. We're wanting them to prepare themselves to wean off the bottle and the breast, if you want, by 12 months old. At the 9-month visit, there's a more in-depth developmental assessment that we do to make sure your baby's staying on track. In addition, as with the other visits, we'll make sure your baby is growing well by tracking them on their height chart, their weight chart, and their head circumference chart. Best news of the 9-month visit for the baby is that there's no routine immunizations as long as you've been keeping up to date with the previous ones. Happy birthday, baby! You're 12 months old. How exciting! Wow, how much you've grown over this last year. Your parents are so proud of you. And mom and dad, what a whirlwind of a year that's been, right? What is your baby looking like right now? They are likely experimenting with taking some steps on their own, if not already walking on their own. But again, don't be worried if they're not doing that yet. Even up to 15 months old is okay for them learning how to take their first steps. In addition, they're likely saying their first specific word, either whether that's mama, whether that's dada, whether that's moo or meow, the dog's name. We count all those things as true words as long as they're using it specifically for that person or object. At the 12-month visit, we will be talking with you about your child's teeth development and how to keep that healthy and clean. We'll be talking about how your baby's brain is developing and how to keep that going. We'll be talking about your baby's sleep. We'll be talking with you about your baby's peeing and pooping habits and how to keep those healthy. And again, we'll be plotting your baby on the growth chart, making sure that they're growing healthy from a weight and a height standpoint. And at 12 months old, it's time for some more vaccines. And that's what the first 12 months of wellness checkups looks like at Frontier Pediatrics. We are so excited to help your baby grow and thrive. You want the best for your child, and you want your child to develop well. We do too. It's important to keep up with your wellness checkups so that we can make sure your child is growing, developing on time. Keep in mind that not all babies will hit all these milestones in the order that we've discussed. That's okay. But if you're following up with your pediatrician, they will help guide you and help you know when you need to be concerned, when we need to intervene, and when it's okay to give your child some more time.